How long is the flu contagious and when to quarantine? Imagine catching the flu and wondering exactly how long you might be spreading it to others. The truth is, influenza is contagious even before you start feeling sick and can stay that way for several days after symptoms appear. Typically, people start shedding the virus about 1 day before they notice any symptoms. Once symptoms kick in, the contagious period usually lasts around 5 to 7 days. During this time, the highest risk of passing the virus to others is within the first 3 days of illness when viral shedding is at its peak. Young children and individuals with weakened immune systems might be contagious for longer periods, sometimes extending beyond a week. This is because their bodies may take more time to clear the virus. The contagiousness begins roughly 1 day before symptoms develop because the virus can be released from the respiratory tract even when a person feels fine. Symptoms usually start about 2 days after infection but can range from 1 to 4 days, depending on the person. The main way influenza spreads is through respiratory droplets. When an infected person coughs, sneezes, or talks, tiny droplets containing the virus are released into the air. These droplets can land in the mouths or noses of people nearby or be inhaled directly. The virus can also survive on surfaces like doorknobs or phones, so touching contaminated objects and then touching your face can also spread the flu. To reduce transmission, health authorities recommend staying home from work, school, or public places during the contagious period. It's best to stay home until at least 24 hours after your fever has gone away without using fever-reducing medicines, and your symptoms are improving. This usually means staying home for about 5 days from when symptoms started. However, some people, especially young children or those with weaker immune systems, might need to stay isolated longer because they can shed the virus for a longer time. Practicing good hygiene is key. Cover your mouth and nose when coughing or sneezing, wash your hands frequently, and avoid close contact with others. Even after your fever subsides, continue precautions for about 5 days after symptoms begin. Remember, individual cases vary, and some people might be contagious longer. Always follow guidance from healthcare professionals and local health authorities. These steps help protect everyone, especially those most vulnerable, and help prevent the spread of the flu in your community.